is which we encounter in day-to-day practice is multifactorial in case of CKD or acute kidney injury. As you can see here, it can be due to uremic toxicity, anorexia, and loss of taste, unpalatable diet. This is very important. You can see if patient is having unpalatable diet, definitely he'll not have that much diet which we prescribe to him. Second, the pill burden. As you can see in CKD patient, there are multiple drugs which has been given to the patient. If patient is diabetic, hypertensive, anti-hypertensive, anti-diabetic, phosphate binders, iron supplement. So this pill burden ultimately leads to anorexia and malnutrition. Dietary protein and energy intake. No proper diet chart is having, patient is having no proper diet charts with proper mentioning of protein, fat, carbohydrate, sodium, potassium, then it can lead to malnutrition. Other factors are related mainly to the disease like inflammation, presence of the comorbidity, metabolic acidosis. Anemia is very important. You have to correct anemia. This is the commonest thing which we can correct in CKD patient or acute kidney injury patient, and we can improve his diet. Now that as far as diet basics are concerned, we have to focus in kidney patients. We generally focus on calories. Protein intake is very important. Sodium, potassium, phosphorus, calcium, fat, and fluid. So this is the commonest what we write in the CKD patient. If CKD patient is having stage 1 to 3, I am not explaining the stages of CKD. They are already explained in this. Like stage 1 to 3, GFR more than 30 ml per minute. Protein, there is no restriction. Energy, there is no restriction. But we have to restrict here also. It is 0.8 gram per kg per day. Energy, it is 30 to 35. That I will explain in the subsequent slides. Now you can see phosphorus and sodium. You can see 2 gram per day. Only sodium that is recommended, that is 2 gram per day. Stage 3 to 5, it is further lower down to 0.6 to 0.75, and accordingly in the end stage renal disease, we have to increase protein. I will explain why I have to increase protein. Acute renal failure is more or less same. It all depends whether patient is receiving dialysis in the acute renal failure or patient is non-dialysis dependent. Now, why we restrict protein in a patients who are non-dialysis dependent? Because it has been shown in the studies that acute ingestion of protein influences the renal hemodynamics. That is, it increases the renal plasma flow, intraglomerular pressure, and glomerular filtration rate. When these three things are increased, anything does not happen in a normal kidney. But when a kidney is already compromised or having some degree of renal failure, this increase in renal plasma flow, intraglomerular pressure definitely will progress this kidney injury to CKD, and finally patient will land up into dialysis. So this is the basic criteria why we restrict protein in CKD patients. So diet recommendation is protein 0.8 gram per kg per day in the stage 1 in whom GFR is more than 90 ml. Calories, it is 30 to 35 kilocalories per day. 30 to 35 means if patient age is more than 60, then 30 kilocalories, and if patient is less than 60, then 35 kilocalories. But in diabetics, it has to be restricted to 30 kilocalories per kg per day. From stage 2 to 5, protein should be from 0.6 gram per kg per day. I have left in this stage 5D because in that we have to increase protein. So you can see here, these are the common things which we daily have in our day to milk. 150 ml, only 4.5 gram protein. Dal, 1 bowl, 6 gram. Chapati, 1 chapati, generally 2 gram. Rice, 50 gram, 3 gram. Paneer, 100 gram. This is 20 gram. This is typo error. It is not 2 gram. Egg white, if you take only egg white, then it is 4 gram. Chicken, 100 gram if you take, you will receive 27 gram of protein. So idea is to only restrict protein. Do not say no to protein to the patients, because it is a common thing when patients come to OPD. You are having CKD, stop all this milk, dal, chapati and everything. You just have to have lauki ki sabji and turoi ki sabji. That is not good for patient. After 1 year or 2 years, definitely patient will land up into the malnutrition. Then it is very difficult for that patient to overcome malnutrition. Now, if we talk of hemodialysis patient or the peritoneal dialysis patient, in hemodialysis, we have to give 1.2 gram per kg per day. In the peritoneal, it is 1.3 gram per kg per day. 50% must be of the high biological value protein. Why? Why we have to increase from 0.8 or 0.6 to 1. You just see here, in 1 HD session, there is a loss of 1 to 3 gram of protein in per session. And peritoneal dialysis, 5 to 15 gram in 24 hours. 5 in a normal circumstances, and if patient is having infection or peritonitis, then patient may lose 15 gram of protein in 1 day. That's why you can see here in hemodialysis 1.2 and peritoneal 1.3. Now, second element is sodium. Why we need to restrict sodium in CKD patient or acute kidney injury or patient related to kidney disease? In non-dialysis patient, it potentiates the action of antihypertensive drugs. When we restrict sodium, it decreases the blood pressure, and by decreasing the blood pressure, you are reducing basically proteinuria, because proteinuria is ultimately leading to the fibrosis and patient will end up into advanced kidney. In the patient on hemodialysis, HD means hemodialysis, that will lower the interdialytic weight gain. Interdialytic means between the two sessions of dialysis. If patient is having high sodium diet, then definitely patient will have a high weight gain, because in dialysis patient there is a less urine output. When patient is having high weight gain, we have to remove fluid too much, and that will sometimes may land up patient with cardiac arrest. So for the 1 teaspoon of common salt is equal to the 5 gram. 5 gram common salt contains 2.5 gram of sodium. This is very important because it's sometimes confusing. We confuse with the 5 gram of common salt means 5 gram of sodium. No, 5 gram of common salt is 2.5 gram of sodium. So we have to restrict sodium less than 2.5 gram per day in each and every stage of CKD, whether dialysis or non-dialysis, and avoid food which has a more than 100 milligram per gram of sodium. That is very important. Third is potassium. As we all know that electrolyte imbalance is very common in all the kidney disease patients. So hyperkalemia and hypokalemia can have serious cardiac consequences for the patient. Hypokalemia can lead to arrhythmia but is rare in chronic dialysis patients. Hyperkalemia is more common and causes reduced excitability of the cardiac cells, and patient may have arrhythmias, and finally that leads to cardiac arrest. So this potassium has to be managed very judiciously, otherwise patient directly will have cardiac toxicity. This is very important. Factors contribute to increasing serum potassium in kidney patients will have reduced renal excretion, because kidney patients will have fibrosis of the kidneys and decreased urine output. Patient may have metabolic acidosis, constipation, diabetes mellitus, use of RAS inhibitors, which are antihypertensives, beta blockers, potassium sparing diuretics, and food intake. If patient is having food intake which contains high potassium. Some low potassium foods are commonly we prescribe: apple, grapefruit, pineapple, cranberries, less used in India, cauliflower, broccoli, eggplant, green beans, rice, and egg whites. These contain low potassium. High, you can have banana. Banana is a very high potassium, so please avoid that. Raisins, orange and orange juice, tomatoes, spinach, potato. We regularly in Indian diet, potatoes are regularly used, but it contains a very high potassium, so it has to be limited. It is recommended that healthy men and women over the age of 19 consume 3400 milligram and 2600 milligram of potassium per day respectively. However, if patient is having a kidney disease, we have to restrict potassium at least below 2000 milligram per day. Otherwise, patient will definitely have hyperkalemia. Next element is phosphate. One thing I like to emphasize here, that commonly we say patient that you have to eat this contain low potassium, high potassium. But if patient is having consuming vegetables, tell them to put that vegetable after cutting the vegetables into lukewarm water for half an hour. That will reduce at least 50% of the potassium that is containing in the vegetables. Phosphate. High phosphate levels are common problem, as we all know, even in the hemodialysis patient, that contribute to the cardiovascular disease because it leads to the calcium phosphorus deposition and osteoporosis. High phosphate level cause serum calcium to bind it, leading to lower serum calcium as well as tissue and vascular calcium. This is very important. If there is a calcium phosphate calcification, definitely arteries are involved, and most common organ to be involved is heart. Low calcium level lead to increased PTH, which increases calcium absorption from the bone, that resulting in the osteoporosis. This whole phenomenon is very important. So with control of the phosphate only, you can save patients from these calcifications and osteoporosis. So limit phosphorus intake from 600 to 800 milligram per day, not more than that, according to the food. Phosphate removal. How we can remove phosphate from the body if patient is having already in the CKD? Hemodialysis, one session removes 500 to 600 milligram in one session, but patient receive only twice weekly hemodialysis. So In a week, only patient can remove 1200 milligram. In peritoneal dialysis, it is 300 milligram per day. Rest to be taken by the different phosphate binders. There are calcium containing phosphate binders and there are non-calcium containing. So we have to use that for the phosphate removal. Foods lower in the phosphorus are fresh fruits and vegetables, rice, bread, pasta and corn. Higher in phosphorus are the meat, dairy products. This is very important. Paneer and milk have a high content of phosphorus. Beans, lentil, nuts, different colas and bottled iced tea. Now we have seen protein, sodium, potassium, phosphorus, calcium. Now what are the markers of protein energy malnutrition which we commonly encounter these type of patients in a kidney disease? If there is a progressive weight loss, if BMI is less than 22 kilogram per meter square, reduced muscle mass to more than 5% in last 3 months, serum albumin less than 3.8 and serum cholesterol less than 100. This is very important to check this malnutrition, otherwise this patient will not respond and have a very bad prognosis. Now I have simplified this table how to monitor the nutritional status. You can see there are different investigations are given and you see here the dietary interview. If patient is on hemodialysis or peritoneal dialysis, monthly dietary interview is very important by maintaining diary also. Rest all investigation in non-dialysis you can do by 3 monthly and in dialysis patient monthly. Now something about renal stones. How we can prevent renal stone, as I am speaking from Jodhpur, and Jodhpur and the western Rajasthan is known for its renal stone belt. Many patients with renal stone, because it's a desert and dry area, patients do not drink plenty of fluids, so they have to drink plenty of fluid, at least 3 to 4 liters per day. In a continuous intake, it should not be the bouts. At least like not that you are drinking 2 liters in the morning and 2 liters in the evening and the whole day you are not taking any fluid. That is not recommended because you have to keep the urine specific gravity less than 1.01. And secondly, at least patient should have a normal person should have a urine output of at least 2 liters per day after drinking 3 to 4 liters. Patient, any population to be recommended with low salt diet, low protein diet and prefer vegetarian diet. This I have elaborated a little. Like you just see here, to pass a 2 liters of urine, beverages like lemonade and orange juice, the citrate in these beverages help block stone formation. Eat calcium rich foods. This is very important. Only calcium rich food. I have not emphasized here the calcium supplement by the tablets. It is not recommended through tablets. Dietary calcium binds to the oxalate in your intestine. This is very important, thereby decreasing the amount of oxalate that get absorbed through the intestine and then excreted by the kidney. If kidney excretes more oxalate, then definitely patient will have oxalate stones. So we have to take a calcium rich foods. Reduce sodium, it has to be recommended between 2300 to 1500 milligram. Why it is recommended? High sodium diet trigger kidney stone because it increases the amount of calcium in the urine. When there is a more calcium excretion, calcium stones can be there. Limit animal protein. A high protein diet also reduces level of urinary citrate. This citrate is basically, it prevents in the stone formation. And when you take a lot amount, this animal protein a lot of amount, then it will decrease the urinary citrate. Avoid stone forming foods like beets, chocolates, spinach, rhubarb, tea and moose nut if you are living in a stone belt like Jodhpur. Now this we all talked about the diet and everything, what we focus on the patient and everything. But areas needs to be focused because we never consider the profound benefit that delicious food can bring to our miserable life. Suppose you are very hungry and if I put a lauki ki sabji in front of you, you won't have. And if you have to have this lauki ki sabji morning, evening for next whole of your life become miserable. So we don't talk about the tasty and the flavorful words missing in the diet counseling. This is very important, tasty and the flavorful. Otherwise, patient will definitely have a malnutrition. It is very simple that I can write any diet. But whether patient is taking that diet or not, because there is no tasty things in that. We identify food items just as some of our nutrients, minimizing or excluding the socio-cultural components of food and communicability. In Jodhpur, kachori and mirchi vada is very famous. And if I say to any patient, you stop this mirchi vada for your whole life, I have taken as his property for his whole life. So if that patient will take 1/4 of that mirchi vada suppose in a month or in 15 days, how does it matter to his illness? Nothing. But considering a socio-cultural component in food, I can give some happiness to him by the tasty and the flavorful foods. So before diet counseling, patient behavior is very important. What he likes and what he dislikes. Culture, what culture he is fond of. He's living in that culture where what foods are common. Society, experiences around the food is essential to understand for recommendation of healthy and tasty diet. This is very important. So attitudes such as spending more time eating, having more social moments around food. Food is if you are having kachori, you will not have alone. You will have your four friends. But if you have anything like turai ki sabji, you will have to have alone. You will not call anybody else from your society. Seeing food as a source of pleasure, not a guilt or concern. This is very important. When patient is having food in his home or anything, he should have not like that. ये बस खाना खाना है ये मतलब नहीं होना चाहिए. It should act as a source of pleasure for him. Thank you very much.
Thank you so much, Dr. Nitin, for such a comprehensive view on the kidney diet. Per se, you covered entire everything what is required in terms of the person shouldn't fall into malnutrition, which is an important aspect, and also any which can be anemia or inflammation or underweight. You covered the CKD and AKD problems, and foremost, what is important is the constituent of major and macronutrients, the calories required, the protein, potassium, phosphorus, sodium, fat, fluid, amount of fluid required in a diet. This all plays a very, very important role. Considering all these has to be planned, for a patient having a kidney-related problem. The foremost thing which you talked about and very important to consider is the behavior of the patient, as in the taste, the flavor, the social aspect. All this, I think, it is part of when considering planning a diet pattern. Entire history has to be known for the patient. I think you very well conveyed all these points, sir. Thank you so much. Now, without wasting much of time, I will move on to the next speaker. Dr. Bhuvneshwari Shankar. It's a pleasure to have you, ma'am, and thank you so much for accepting our invitation in such a short notice. Dr. Bhuvneshwari is the chief consultant at Apollo Group of Hospitals, and she's the chief covering entire Apollo Group of 70 hospitals. And she's the adjunct professor at Manipal Academy of Higher Education. She has the doctoral committee member also at SRM Medical College, Chennai. She has a very rich experience of 36 years. We are very fortunate to have you, ma'am. She was the vice president, dietetics, and the group of chief dietitian for Apollo Hospital. She's been with the Apollo Hospital for last 36 years. The day one she's been practicing, and till now she's been with Apollo Group. She's an examiner for various universities, member of Board of Studies, Nutrition, Madras University. She was an expert committee member, Nutrition Board, Government of India. She has presented in numerous number of papers, and she's been a speaker for various national and international conferences. She has a very vast research experience and released in national and international journals on clinical nutrition. She's released Apollo Clinical Nutrition Manual for Adults and Pediatrics, a step towards raising the caliber of clinical nutrition across the globe. She's also released dietitian pocket book, I think, which is very, very important on the basis of best of basics in clinical nutrition for adults, pediatric, and transplant nutrition. She's accredited teacher for European diploma in nutrition and conducted by ESPN. and she is recipient of various awards like the Senior Leadership Award, Excellency Leadership Skills in the Department of Dietetics. She was also awarded with Lifetime Achievement Award from the Jabas College, Chennai, and was also awarded with Lifetime Professional Achievement Award by the Apollo. I mean, she has so many credentials to her asset. We welcome you, ma'am, and looking forward for a very knowledgeable session. Are you there, ma'am?
Yes. Is my slide, are you able to see my slide?
Just a minute, ma'am.
How do I share?
Just a minute, ma'am. Just see whether. It is in the process. I think it should open up.
Are you going to put the slides, or I don't know how to share here?
It's not yet open, ma'am.
That's what I don't know how to share the slide here.
Go, Anurag. Ma'am, we'll try and open it from here.
Okay. I can do it from here, but I forgot.
It is actually showing you presenting to everyone, but it's still not opened.
You can see my slide even now?
No, not yet, ma'am.
Ma'am, you have to click share. Present no option. Ma'am, you have to click present no option.
Where do I go and see?
Yes, ma'am, on the screen.
On the screen, you will see an icon saying present now.
No, it's not coming. That's what I'm asking.
Ma'am, speaker, camera, and besides this, there is an icon present now.
1 minute. Speaker.
No, it still says School of Public Health is presenting. Or can I share the slides from here, ma'am?
Ma'am,
Now can you see the icon, ma'am?
Is it shown now?
no, ma'am. Ma'am, can we present from here?
Yeah, please do. Please do. Oh, it says present now.
Dr. Rachna, I am sharing the slides from here.
Yeah, please share.
I am sharing the slides from here.
Okay.
Yeah.
Yes. Is it visible to all now?
I can see it. Can we start?
Yes, ma'am, please.
Yes, ma'am, you continue. I can change the slides.
Yeah, okay. Thank you very much for inviting me, Jodhpur AIMS, the organizing team. My topic is low purine and low oxalate diet. Okay, many a times patients come to us saying, I've got urinary stone. As a dietitian, first we need to understand what stone it is. People with uric acid stone, or people with oxalate stones, or some with calcium oxalate stones to come for consultation. So if you look at kidney stones, it's common disorder of the urinary tract, affects around 12% men and 5% women. And multiple recurrence also happens, and extreme pain is involved. If it's continuously stones are formed, it can damage the kidneys. Next slide, please. There are risk factors for stone formation. Number one is body weight. People obese are more prone. High sugar intake, vitamin B6 deficiency can cause. Thiamine deficiency also associated with stones. Dehydration, not having enough water can also cause, make the urine more concentrated and stone can be formed. Next slide, please. So what are the dietary things? Formation of, one calcium oxalate stone has 50% chance of forming additional stones. There are enough researches done that people have repetitive stone formations. Next slide. So there are metabolic causes: hypercalciuria, hyperuricosuria, oxaluria, cystinuria, renal tubular acidosis. These are various forms of stones happening in the kidney. So drinking water definitely is a must. As the previous speaker spoke, it's not enough to take water. You need to pass around 2 liters of urine, and water intake should be continuously taken from morning till night. There are people who get up in the morning, drink 2 liter water. It's not correct. You need to drink throughout the day. Next slide. Aerated drinks have to be avoided because number one, they are acidic in nature. It eliminates calcium through urine, and these has been linked with diabetes because of it's high in sugar, high in calories. Next slide. Low oxalate diet. Next slide. So if you look at oxalates, they are found in wide variety of foods. Animal foods usually do not have oxalate. First, as dietitians, we need to understand the difference between oxalate and uric acid rich foods. Limiting oxalate intake to 40 to 50 milligram per day is advised. If you look at low oxalate foods, less than 2 milligram per serving, this can be taken as much as one wants. Moderate oxalate between 2 and 6 milligram per serving. You should not eat more than 3 of these foods. High oxalate foods, 7 milligram per serving it provides. Next slide. Drinks, if you look at low oxalate, it is apple juice, ginger ale, lemon juice, lime juice, low fat milk. Moderate oxalate are coffee, cranberry juice, grape juice, orange juice. High oxalate, any juices from high oxalate fruits, then chocolate milk, cocoa, instant coffee powder, Ovaltine, brewed tea. Too much of tea can give you more oxalate. Next slide. So looking at dairy, low-fat milk, buttermilk, dahi, cheese, these are not high in oxalate, but if there is calcium stones, where you need to reduce the calcium intake, it should be limited to 1 serving. High oxalate, chocolate milk should be avoided. Next slide. Meat, all this meat are low in oxalate. Moderate oxalate is beef, kidney, and liver, organ meats. High oxalate, none of the meat products have high oxalate content. Next slide. Proteins. Low oxalates are lentils. And, it's better to opt for vegetarian food, whole pulses, low fat milk. Non-veg, fish, chicken, egg white, 50 to 75 grams per day, not more. High oxalates among protein rich are nuts, almonds, cashews, walnuts, beans, okay, peanut butter, peanuts. So it's better to avoid whole fat milk and its products, organ meats, fish, sardines, whole soybean, better to avoid because it's rich in oxalate. Next slide. Fats, it's better to be on a low-fat diet with 4 to 5 teaspoons of oil per day. Coconuts, almonds, cashews, nut butter, deep-fried foods, high-fat desserts, better to avoid. Next slide. Fruits. If we look at fruits, looking at high oxalate fruits, berries are high in oxalate, red currants, dried fig, grape, purple, gooseberries, kiwi, lemon peel. So all berries, currants, fig, fruit cocktail, kiwis, orange peel, apricots, better to be avoided. Our ordinary fruits, which are our seasonal fruits, are not very high in oxalate. I would call them moderate oxalate foods. Next slide. Bread and starches, if you look at it, white corn, marmalade, soybean crackers, wheat germ, the bran, whole wheat bread, barley, rye, these are high in oxalates, better to avoid. Our ordinary white rice, brown rice, oatmeal, corn, these are okay. Next slide. Among vegetables, beans, dried beans, brinjal, lady's finger, mushrooms, spinach, they are high. Tomato in a concentrated source only needs to be avoided. Actually, tomato 100 gram has pretty less amount of oxalate. If it is one tomato or two tomatoes used for the whole family, it's not a big concern. Except taking too much of tomato, it should be avoided. Next slide. Among condiments, cinnamon, parsley, pepper, ginger, soy sauce are high. Here turmeric is also mentioned, but the amount of turmeric what we use is pretty less. Soy rich, it's better to avoid. Many people with lactose intolerance or for weight loss start taking too much of soy that can lead to high oxalate amount in the urine. Next slide. Dietary versus drug therapy. In addition to dietary counseling, physicians might use pharmacological agents. However, none of these agents have been proven as effective as a high fiber, low oxalate, low salt, low animal protein diet. So, next slide, please. Star fruit. Here, I need to mention something. Star fruit is rich in oxalic acid, and people with even mild kidney disease, when they take star fruit, it can lead to neurotoxic and nephrotoxic effects. So when we talk about oxalates or kidney disease and fruit, we have to mention about star fruit. It is mostly available in hill areas, but of late we get in any of the cities. So star fruit consumption should be about star fruit, we need to explain to people. Next slide. So it's better to avoid all high oxalate foods if one has a tendency to form oxalate stores. Next slide. I think we will switch on to low purine diet to avoid uric acid. Next slide. So risk factors, a protein-rich diet, especially when people go on various weight loss diets where they cut down carb to a great extent and increase the protein level too high, obesity, conditions like polycythemia, increased red blood cells, lymphomas, and various other cancers can increase the uric acid levels. Diuretics and kidney diseases also, people with kidney diseases also have high uric acid. Next slide. Prevention, avoiding very high protein rich diets, balancing body weight, avoiding dehydration, especially in hot weathers, avoiding strenuous exercise where you end up losing a lot of fluid from your body, reducing alcohol consumption, maintaining the concentration of uric acid within normal range. Next slide. So purine content of foods, if you look at carbohydrate, yeast, bakers of glucose, yeast is high in uric acid. Oatmeal and wheat germ to be better to avoid. So when we take the diet history, we need to check how often do they take oats and how much. All other cereals are okay. Next slide. Vegetables, again mushrooms, spinach, asparagus and cauliflower, better to avoid. Like if they are going to take once in a while, it is okay. But most of the vegetable, except those mentioned as high in uric acid, like moderate to high, it's better to avoid. Next slide. About poultry and fish, sardines, mackerel, herring, organ meats, liver, kidney, brain, heart, minced meat, meat soups, soybean and its products, better to avoid. Next slide. Again, it's mentioned here, the list, which are specially organ meats, certain kinds of fish, and dried beans and beans. And masoor dal is supposed to be increasing uric acid among the dals. Many, part of India, certain parts of India, like Eastern India, they take a little bit of masoor dal. We need to explain to them to cut down masoor dal intake. Next slide. Among fruits, avocados are high in fat. We need to educate patients on it. Otherwise, fruits and fruit juices are okay with regard to uric acid. Next slide. Condiment spices. And alcohol, alcoholic beverages and beer better to be avoided. People who have high uric acid invariably consume quite a bit of alcohol or beer. They need to be educated on cutting down or totally avoiding. Next slide. I mean, this is the overall slide about all the high purine-rich foods, low purine foods, and moderate purine foods, which are already mentioned. It's better to be on a vegetarian diet. You advise people to take plenty of water and pass a lot of urine. Among vegetables, only very few are to be avoided. Among dals, as I said, masoor dal need to be cut down. Otherwise, being a vegetarian, having healthy weight, drinking good amount of water, passing enough urine will cut down the uric acid content, and on a low purine diet, uric acid will come down. Next slide. Thank you very much for patient listening. We have finished well on time. Thank you for patient listening.
Thank you, ma'am. Thank you for such a detailed session you took on the type of diet to be taken complete in terms of food groups. The renal stones and low salt and supplements which are not required. You covered all that, and important aspects of in terms of low purine also. You said the wheat bread and other things which can be included, and avoidance of alcohol and cashews and chocolate milk for oxalates. So thank you, ma'am. Thank you so much for detailed talk given. It has certainly enhanced our knowledge and will help the practitioners in their daily routine. Now we move forward to our next speaker. We'll have the question and answer sessions after the third speaker. So if anybody has questions, can put up in the chat box. Now we have Dr. Prem Prakash Vyas. He's the Associate Professor and Head at PG Department Ayurveda Pediatric, Dr. S.R. Rajasthan Ayurvedic University, Jodhpur. And he holds a lot of other responsibilities also, like he's the head of the University Media Cell, University Placement Cell, and head of Center for Innovation and Research Network. His educations are, he's a BA, MS, NIA from Jaipur, MD, IPGT, NR University of Gujarat, and PhD from NIA, Jaipur. His areas of specialization are Ayurveda Pediatrics, including Ayurveda Immunomodulation. He has teaching experience of 16 years and research experience of 10 years. He's guided 7 research scholars, and he's published 10 articles, both in national and international journals, and organized a lot of conferences on mother and child healthcare through Ayurveda. He's got a lot of interest in community work also. He's organized more than 50 medical camps, and presently he's the principal investigator of project on COVID-19 pandemic. Thank you so much, sir, for joining us. Looking forward to hear you from Ayurvedic point of view.
Thank you, ma'am. Thank you for inviting me. I extend my cordial thanks to Professor Bharadwaj sir and the whole organizing team of the School of Public Health. So, just I'm going to share my slides. Are my slides are visible? Hello?
Yes, sir. Yes, sir.
Thank you. And
yes, sir, it is visible.
So nice, so nice. So I'm talking on Ayurvedic perspective on low oxalate diet and low purine diet for the chronic kidney patients. First of all, as our previous speakers have highlighted in detail, I think most of the informations are to be repeated. So now, firstly, I take low oxalate diet. These kidney patients are to be keenly observed from various aspects in terms of hemodynamics of their renal functions and other systemic variations, because they can develop emergencies on several times. So the diet is very important role in their day-to-day routine life and their maintenance of health, ill health. So adequate fluid intake, first of all, because we know that the kidneys are very important organ to the cleansing mechanism of the body. So being an excretory organ, fluids are required in plenty to flush out several toxins produced during metabolic process. So adequate fluid intake throughout the day, like lukewarm water, coconut water, buttermilk, etc. And tea and coffee intake should be in limited quantity. Salt intake should be measured and to be advised in the very limited quantity, along with the packaged and bakery food items. Limited consumption of animal-based protein diet like eggs, fish, chicken, red meat, paneer, etc. Certain salad items are also in our practice in our routine dietary habits. So vegetables like kheera, kakdi, kaddu, saijan, parwal should be consumed. Limited intake of greening leafy vegetables like spinach. Ulat, a kind of dal, is beneficial for kidney stones. It can be consumed as soup, etc. Barley is another important cereal for kidney stone patients. Increase the amount of calcium in diet. So as Dr. Vajpayee has advocated for calcium-rich food instead of calcium supplements. So increase the amount of calcium in diet, limit the vitamin C content of diet. Here, nowadays we are much listening about the intake of vitamin C, but this vitamin C should be taken in a very limited and required doses. Drink the right amount of fluids every day, eat the right amount of protein daily, reduce the amount of sodium in diet, as Dr. Vajpayee has already discussed. Certain medicinal plants have a very important role to regulate hemodynamics of kidney, including Goksura, means Tribulus terrestris, Punanava, Bhairivya, diffusa, Varun, Pashanabhed, Sigru, and several medicinal formulations like Rinu Panchamul Quat, Varunadi Quat, Chandra Prabhavati, Gokshuradi Gugulu, Swet Parpati, Hazul Yahud Bhasma, etc. These are very, very beneficial in the management of kidney stones. This is the picture of Goksura, means Tribulus terrestris, available widely in Rajasthan and North India. Puranava Borevia diffusa, we can see it in rainy season everywhere, in footpaths also. Varuna, the Platyva religiosa, another one is Pashan Bhed, Virginia lingulata. Moringa oleifera is a very well-known herb. Shuddha Gugulu Comifera Mukul is again a very important Ayurvedic medicine. So, among foods that come from animals usually have little or no oxalate. So, these are advised to the kidney patients to help prevent oxalate stones from forming. Limit oxalates to 40 to 50 milligram per day in diet. Low oxalate foods have less than 2 mg of oxalate per serving, while moderate oxalate foods have 2 to 6 mg of oxalate per serving, and high oxalate foods have more than 7 milligram of oxalate per serving. So these high oxalate and somewhat moderate oxalate foods are to be avoided by these patients. These foods have a very high level of oxalates, so these are to be avoided. Spinach, bran flakes, rhubarb, beets, potato chips, French fries, nuts and nut butters. Several foods, here we are seeing various classes of our dietary items, fruit, vegetables, seeds, legumes and grains. Among foods, berries, kiwis, figs and purple grapes, etc. are having high oxalate foods, and therefore these are to be avoided. Among vegetables, potatoes, rhubarb, okra, leeks, spinach, beets, Swiss chard, etc. have high level of oxalates, so these are to be avoided. Some dry foods, including almonds, cashew, peanuts, and soy products, are also having high oxalate levels, so these are also to be avoided. Some grains, including bran flakes, wheat, germ, quinoa, etc., are having high level of oxalates, so these are to be avoided. Also, cocoa, chocolate, and tea, because of having high level of oxalates, are to be avoided. Now we come at low purine diet. Some food articles have very low purine levels, so these are advised to these patients. The good foods include bread, cereals and pasta, low-fat milk, yogurt, cheese, coffee, eggs, whole fruits and vegetables, potatoes, nuts, celery, cherry and coffee, triple C. Regarding water intake, staying hydrated helps the kidneys to remove uric acid from the bloodstream and the body. Low-fat dairy products are suggested to intake because low-fat and fat-free options are best for foods such as milk, cheese, yogurt, and frozen yogurt. Grains and starch include foods such as bread, pasta, rice, potatoes. Favor whole grain products always for these patients. Fruits and vegetables are helpful, and a person should favor whole fruits and juices with no added sugar. Vitamin C, though, is advisable, but some considerations are there. Good source of vitamin C include grapefruits, oranges, pineapples, strawberries, bell peppers, tomatoes, and avocados. This vitamin C should be intaken in required doses, not in excess. Lean proteins may be debatable that a small or moderate amounts of poultry and fish will raise purine levels. So some doctors do not believe and some believe. So it is quite debatable. Eggs, a person should only consume little to moderate amounts. Regarding coffee, tea, and carbonated beverages, these may be beneficial in reducing urine load. Following are the high purine foods that are to be avoided, include bacon, that is pig meat, liver, sardines and anchovies, dried peas and beans, oatmeal. Vegetables that have high purine content include cauliflower, spinach, and mushrooms. High fat foods hold uric acid in kidneys, so a person should avoid fried foods, full fat dairy products, rich desserts, and other high fat items. Among alcohol, beer and whiskey are high in purines, but some research show that all alcohol consumption can raise uric acid levels. Alcohol also causes dehydration, which hampers the body's ability to flush out uric acid. Sweetened beverages, fructose is an ingredient in many sweetened beverages, including fruit juices and sodas, and consuming too much puts a person at risk for gout also. So here again, an advice to drink plenty of water appears. Uric acid passes out through urine. If plenty of water is not consumed, level of uric acid may be increased in the body, and patients may prone to get several further pathogenesis. According to the National Kidney Foundation, consuming 8 to 10 glasses of water per day helps reduce risk for gout and urolithiasis. Some of these are having low protein, low purine levels. So we already take these low purine food items in our routine diet. Several medicinal herbs are very good properties in dealing with kidney pathologies, nephropathies in particular, include Algae morarum, Tribulus terrestris, Nigella sativa, Aldea orcheri, Lectua sativa, Prunus syriacus, Algae camerorum, Mangifera indica, Prangos, Ecolis, Urtica, Dioica, Fumaria officinalis, Medicago sativa, Apium globulins, Rheum ribes, Arctium lappa, Pimpinella, Anisum. So, I want to add something here that particularly in this desert division of Rajasthan in Jodhpur, particularly, thousands of families are taking their routine diet, adding imli, amchur, tomato, curd in preparing their sabjis. And as a result, I observe for since last 16 years in my practice in Jodhpur itself. I observed that when I advise my patient to restrict these acidic food articles, citric food articles. So avoiding the acidic content in their diets, the body gets relief in many terms by reducing acidic contents in the blood. I remember that 1930s, one European medical scientist had gotten a Nobel Prize only to establish the fact that if a person restricts some acidic food items on regular basis, he can prevent so many big health problems. So Ayurveda always advises not to consume these acidic food articles on regular basis. This is this rule. I'm not saying this rule, but on the basis of my observation, some persons are very much sensitive to take mirchi vada, to take amchur on daily basis in their food. They gradually develop the state of hyperacidity. So to get pentaprogelam in the morning is not a solution at all, because this chemical also produces several side effects. So this practice should be discouraged. Instead, patient must be advised to avoid these acidic food contents on regular basis. He should take these contents once or twice a week only. And miraculously, I observed a very fast recovery in several inflammatory health complaints, hyperacidity, several types of chronic dermatological pathogenesis. So it is advised that to considerably limit these acidic food items on a regular basis can prevent several big pathologies in years to come. So to get rid of blood pH, to convert it high acidic, is the main motto from Ayurvedic point of view, to check the renal pathologies through diet. Thank you very much. Thanks a lot.
Thank you so much, sir. Covering the Ayurvedic perspective, you talked about low oxalate diet and importance, and what is required is ample amount of fluid intake and lukewarm water, coconut water, buttermilk, and you also said that Kulta horse gram is good for renal stones. Inclusion of kheera, kakadi, kaddu, parval, and you also talked about the role of medicinal plants and the usage through decoction, and the limit of certain food items like spinach and limiting the intake of vitamin C. However, you mentioned that vitamin C should be given in for low purine diet. So fluid intake should be very important, and so the calcium intake is, and that's what you advocated for too, so that at the it combines with oxalate and it doesn't get accumulated in the renal part. So thank you again, sir, and now we look forward for the question answers, and we request all these speakers to answer as per their the questions asked to them. I think sir is also here. The first question is, in gout, any role of low oxalic acid diet to manage gout?
Yeah, definitely. In gout, there is a patients are advised to take a low oxalate diet, and especially low purine diet also. So tomatoes, spinach, and all that we have to reduce in the gout, in particularly, and because gout is mainly managed by rheumatologists, but patients with hyperuricemia in kidney also, we generally advise patients to reduce these diets.
Thank you, sir. There is another question of role of beer in flushing out renal stones.
No, basically this is an old idea. I don't know where this idea has been erupted out, but basically fluid therapy is advised, and beer acts as a diuretic. So the urine flow increases. So somehow this idea erupted. If you take a beer, this kidneys will flush out. It is not like that. You have to take at least 5 to 8 liters of fluid daily. That will flush out your stone. And if you are taking beer with so much of quantity, the other side effect may overcome.
Thank you, sir. I think now there's a question for ma'am. Removing seeds from tomato will help to reduce the incidence of oxalate stones.
This is a common myth, I will say. Okay, when we allow one small tomato or 2 tomatoes for the whole family, no point in removing seeds. This is my opinion. I'm sure the doctors can add on their opinions.
Would you like to add on something?
No,
tomato seeds.
No. Actually, madam is right. It is no point in removing the seeds, because there is no literature available that after removing the seeds, what extra benefit you will get from tomatoes.
Okay. Now we have a question for Prakash sir. You talked about medicinal plants like Goshura, Munarva, Giglu. How are they taken and what should be the dosage?
Yeah, ma'am. There are several medicinal compounds made up of Goshura, Purnava, etc. So I also mentioned one Commiphora mucul, that is Google also. So Gugulu and Commiphora mucul, Gugulu and Goshur, both are combined in a medicine termed as Goshuradi Gugulu. Likewise, Purnava and Commiphora mucul are also combined in a medicine called as Purnava Gugulu. And 2 tablets BT or TD for adult patients, and these are to be reduced in pediatric patients.
Okay. So you also talked about decoction. So can these be taken?
Yeah, ma'am. Yeah, ma'am. Several herbs are to be boiled in given methodology, and several preparations, means distilled aqueous extracts, are also available of Gugulu and Purnava also, and they have a miraculous results in managing these nephropathies also, including renal calculi and higher level of creatinine, etc.
Okay. I think another question for Dr. Nitin, is protein required to be restricted for stone?
Yeah, definitely. Protein restriction is to be required for stone formation because, as I've told you in my slide also, that if patients are taking high protein diet, high protein basically is the animal protein. If patient is taking the Indian vegetable diet on protein, I don't think Indian vegetable protein, the dal, paneer will get add on to that. But if patient is taking high animal protein, that has to be restricted. Otherwise, it will lead to the stone formation.
Okay, thank you, sir. Another question on like renal stones, gallstones also have different types.
Gallstone generally are of the same type, but it is not in my domain. But renal stones are definitely 3 or 4 types: calcium oxalate, calcium phosphorus, uric acid stones. These are different types of stone. After the removal of the stone, generally surgeon send those stones for the metabolic profile or to look what stone type is this, and then accordingly the patient diet is modified.
Thank you, sir. Ma'am, there's a question for you. Diet restrictions to be followed for gallstones.
Okay, generally gallstone people, we suggest them a low-fat diet, and we should look at their weight. Third, their triglycerides also need to be checked. So, if required, we may have to cut down the calories, especially the carb calories also. So, one needs to take a diet history, weight history, and look at gallstones. Most of these gallstones patients I have seen are pre-diabetics too. So it is an overall healthy diet plan according to their health condition, but predominantly a low-fat one.
Thank you, ma'am. So there's a question, if unaware of type of stones, what are the factors need to be considered for diet?
If you are unaware that there is a stone or not, then for the prevention of the renal stones, we have to take plenty of water, as I have already told you, with a urine output of at least 2 liters per day. It is not so that you have to measure, it is an approximate amount. Vegetable diet is advised. Dietary calcium supplement is advised. Mind it, I am again emphasizing dietary calcium supplement, not the tablet supplement. It is only the dietary calcium, fluids, and vegetable diet. These are the 3 factors. And if suppose you are having stone forming tendency, then tomato, spinach, beetroot, these foods are to be avoided. Chocolates also.
Okay, so type of stones. Based on type of stone, what factors need to be considered?
On the type of stones, different factors. Like if patient is having an oxalate stones, then it needs that protein diet is to be reduced. Secondly, if patient is having calcium stones, then calcium phosphorus should be checked. That is, patient is only on tablet calcium, or any patient is taking high milk proteins or dietary like paneer, etc. Then for the phosphate stone, this has to be checked. If patient is having a citrate stone, as I have told you earlier also, that in that also the water, the daily intake of the fluids, plus if there is patient is having UTI, that has to be checked, because UTI again leads to decrease in citrate and patient is having a stone. So there are different diet modification, but almost major part of the diet remains the same. Only few parts changes on depending on the stone, what type of stone is that.
Thank you, sir. Ma'am, there's a question on what role does apple cider vinegar plays for curing stone problems?
There is no evidence that it helps. That's my answer.
Okay. So would you like to add anything? No. Okay. So there is a last question we have. Can we recommend calcium supplements to kidney stone patients?
We can recommend calcium supplement to the kidney stone patients, but always looking at the investigational value or the biochemical parameters. It is not so that patient in India, what is the common factors? Like if your mother, father, or grandfather is having some bony pains or knee pains, their age is above 70, we generally start with a calcium supplement, not knowing the fact whether this calcium supplement is benefiting or not. So if patient is having hypocalcemia or there is a deficiency of vitamin D, and if it is recommended looking the biochemical parameters, then only we can recommend, otherwise dietary calcium will suffice.
Thank you, sir. Now we finished the last session on question and answers. I think now we sum up the entire session. I'll request Dr. Pankaj to say a few words.
Okay, thank you so much. And I believe it's wonderful to have all of you with us. At the outset, I would like to thank all the participants, because it's all about the participants. When you have a lot of speakers, the kind of enthu remains when we have such good participants. So it's lucky to have good participants in the entire session. We would also like to acknowledge the International Epidemiological Association, IEA, who have given us this opportunity to co-host this webinar with them. And to all the speakers, as for today, we have with us Dr. Bhuvneshwari Shankar, who has taken time from her busy schedule to be with us, and Dr. Prem Prakash Vyas, sir is from Ayurveda University, and it's nice to have him with us during this session. Once again, I would like to thank the people who are over here. We have Dr. Nitin, who is our own colleague, but he has taken time, his spare time, to be with us during this webinar. Our Dr. Rashmi Rathod, who has been tirelessly working for all these 5-6 webinars, to be with us for the entire sessions. My own team from School of Public Health, today Yachna is with us, Dr. Yachna, and we have Dr. Dilipan and others who have been working in this. Once again, thanks for joining. You'll get the certificates. We request you that as there is a capacity of emails, your certificates will be sent to you. Maybe in 2 days or 3 days, you'll get, all of you will get the certificates. And if there are still some queries, we would be happy to take all those queries. You can kindly email them to us on the email which is being mentioned in our webinars. Thank you so much. Once again, stay healthy, stay safe, have a nutritious diet. And as we say that this is the season of festivities, so take care of yourself in this tough time of COVID. Thank you so much. Namaskar.
Thank you, sir. Thank you, sir. Thank you very much, sir. Thank you. Thank you, sir.
Bye-bye. Bye.